Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening, everyone. Welcome to All County sponsored You and Your Doctor. All County Healthcare is a Medicare certified home health agency working in Dade, Broward, and Palm Beach County. For more information, you can contact All County info at allcountyhealthcare.com. 954-717-7027. I am your host, Dawn Graubert. I'm excited. We have a new physician joining us this evening. We've got Orthopedic Surgeon Dr. Behnam Myers joining us. Dr. Ben is a board-certified orthopedic surgeon specializing in the surgical and non-surgical treatment of spine-related disorders. He is known for his expertise in minimally invasive spine procedures and motion preservation surgery with a focus on improving patient outcomes while reducing recovery time. Dr. Myers is affiliated with several leading hospitals in our area, from Adventura Hospital, Broward Medical, Jackson North, and many, many more. His practices are located in Coral Springs, Hollywood, and Boca Raton, Florida. So let's get right into it. Let's bring Dr. Myers on. Good evening, Dr. Myers.
Good evening. Thank you for having me on.
Thank you so much for joining us. We're so excited to have you. New doctor, new perspective on orthopedic care. Let's go into some background on you.
Sure.
Why did you become
I love the title new doctor. I've been doing it over 18 years, but I'll take new.
Well, you're new to All County and you're new to the show, so it's a pleasure to meet you over the airways.
Me too.
Some information. Your practices are in Hollywood, Boca, and Coral Springs.
Yes, Hollywood, Boca, and Coral Gables.
Coral Gables. And the best way to reach you would be at spinesolutionsfl.com.
That's our website. Just log on and you can learn a little bit more about me.
And the best phone number. This way people who are listening know how to contact you.
954-983-3888.
All right. Now we can get into the real fun of it. Let's give us some background on why you became a physician and why an orthopedic surgeon.
Okay, I'm going to take a nice deep breath and give you the whole story.
Okay.
My name is Behnam Myers. I was born in Iran. I was born in Tehran. English is my second language. I think I've learned it pretty well. My twin sister and I immigrated to the United States in 1980. We grew up in Southern California. I came just here with my mother, my twin sister, my grandmother, and I. I ended up learning English sitting in my uncle's office. He's an orthopedic surgeon, and he's my role model for what I deem to be the ultimate form of success, to become a physician. Learned English, went to college there, University of California, Riverside, went to graduate school at Loma Linda, and then eventually got into medical school at the University of New England in Maine. I traveled cross country. One of the places I visited was South Florida. Of course, I fell in love here. There's nowhere better, and I've traveled the whole country. My apologies to anybody outside of the state that may hear this. Couldn't wait to stay here and get back here. Met my wife. She's a nurse. My mother is a nurse. My twin sister is a pediatric endocrinologist. So we just kept it as a healthcare family.
Which is a great story. You love South Florida, even coming from California. But why orthopedic surgery?
You know, it's a field of medicine where you can address multiple areas of injury and really help people regain function if you choose to in the correct fashion. I also hurt my back at the age of 16 in a very vicious car accident. So I have empathy for my patients. I know what they're going through.
Are there different modalities instead of rushing to surgery for treatment of back pain?
The only time you should rush into anything is falling in love or or as far as emergency surgery is concerned, um, we don't do a lot of emergency surgery. Most of our cases are elective. I prefer that patients have maximized and exhausted conservative care.
And when would the patient come to you? What symptoms would you be looking for? Because I think people have the misnomer an orthopedic surgeon is a surgeon, surgery first. Do they come to you for lower back pain? Do they come to you for pain radiating down their thigh, sciatica, neck pain?
The majority of the things I operate on are, in addition to back and neck pain, are radiating pain. That's pain that originates from the neck or the back and may go down the arms. Symptoms that most patients will present to our office with, in addition to the pain in the location of the spine, is numbness, tingling, persistent cramping to the arms or legs, difficulty walking. Patients will describe that they feel better flexed forward, and when they stand up, their legs go numb. They can usually go about a block, 2 or 3 blocks. They experience cramping to the legs, back pain, requiring them to sit down. Pain in the gluteal area, the lower buttock area, pulling sensation. These are the majority of the things that we look to ameliorate or reduce with surgery.
And how have you seen medicine change? Your uncle was an orthopedic surgeon. I'm sure back then, treatments, the way surgery was performed is a little different than it is now.
People of my age and my contemporaries and above have understandably seen poor outcomes resulting from spine surgery. But as there's been advances, and those such as myself who've embraced those advances, understand that now we have MRIs, we have intraoperative neuromonitoring that I use. We have intraoperative x-ray that we use. I use an advanced microscope that allows me to use a very small incision to perform a lot of work under an area that allows for minimal to almost no blood loss during the procedure. These are just small amount of advances we've made. I can test the hardware to make sure it's in the appropriate position. I can x-ray the hardware to make sure it's in the appropriate position, and I can confirm that it's been done through more than one variation.
And some of the other things we're looking at, does your office do physical therapy,
So
occupational?
I do not do the physical therapy. We prefer that patients have tried physical therapy, perhaps even tried pain management, non-narcotic medications, and they find that now they want to talk to a surgeon and now they want to understand surgical options if available and just get an honest opinion on what could or could not be expected as an outcome from surgery.
And so they're coming to you after they've tried everything else.
Most people, yes. Now, people do in fact come straight to top of the pyramid, so to speak, in order to get an opinion from me. And that's okay. I don't discourage that at all. We will help you develop a plan, guide you to find places that are going to help get you the goal that you're looking for. I don't discourage people from surgery. I more rather prefer that I encourage people to maximize conservative care prior to considering surgery.
And what do you think your technique, how it stands out from other spine surgeons in the area?
So I don't like anybody to believe that they have a monopoly on any field of medicine. If someone professes that they're the best in their field, then they don't really have a breadth of what the field is. My philosophy is if I'm not the best person for the problem that the person has, the patient, I'll have them find who I think is going to be the best for them. I've refined my skills since my initial fellowship. I've spent a lot of time learning alternative techniques, minimally invasive techniques, so much so that now I'm a professor at Nova Southeastern University. I'm a professor at FIU Wertheim School of Medicine. I've been just designated a professor for Orlando College of Osteopathic Medicine. So I have refined techniques that allow for me to do these procedures. They're more tedious at first, so it's a steep learning curve, But once that learning curve is met, my results allow for faster recovery, to get up earlier. I don't want to talk about what other people are doing because they don't know what I'm doing, and I don't pay attention to what they're doing. I pay attention to what I'm doing in my results.
So the idea is minimally invasive, smaller incisions, easier recovery time, back to work or back to your lifestyle.
Yes, my patients are getting up that night.
That night. Wow.
Yes.
Outpatient
Yes.
versus inpatient?
We allow for the option. I don't obligate anybody to make a decision for themselves. If some patients want to stay in the hospital. And I said, sure, if you want to stay in the hospital, we're okay with that. I'll come and see you the next day. I'm going to call you that night anyhow. I'm going to come and see you after surgery. I'm going to see you the next day or at least check on you if you do it outpatient. So we leave it up to the patient.
And your most common patient comes to you, herniated disc, sciatica. What are your standard bread and butter?
So I have designed and patented a device for sacroiliac fusions. I have taught courses in minimally invasive spinal fusion, facet fusions. Most patients are seeking me out, happen to be the younger, more athletic people that are looking for an option that's going to allow them to return to their prior injury or prior symptomatic activities of daily living.
And what's the difference between a facet infusion and a sacroiliac fusion?
So a facet fusion allows to fuse the small joints in the lower back. Sacroiliac fusion is for the chronic pain that people get in the lower buttock area. You have to do a physical exam. You have to look at the MRIs. You have to speak to the patient and to get an idea of what's going on.
Because I think patients, you come in with lower back pain and everyone's telling you what you think it is and you have no idea, but there's so many nuances of what it actually is and the different fusions that you could potentially need and use with you.
So in order to know what to offer, you have to have the ability to offer a wide variety of options. And that's what I chose to do with my life. I chose to spend a lot of time doing cadaver labs, learning new techniques. If I'm introduced to a new technique, I will learn it. Even if I don't intend to use it or spend a whole day, 2 days, a weekend, a week, a month learning it, at least I know what I do and don't want to do because I've learned what the options are available.
The nuances of medicine. Dr. Ben, we're going to take a quick break. We're going to thank our sponsors. We come back more with Dr. Ben Myers, orthopedic surgeon. Stay tuned, and we'll be right back.
Thank you.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And welcome back to You and Your Doctor, sponsored by All County Healthcare. I am your host, Dawn Graubert. For more information, to get a hold of All County, you can call them at 954-717-7027 or email them at info@allcountyhealthcare.com. Tonight we're talking to Dr. Ben Myers, a orthopedic surgeon down in the South Florida area. So let's bring Dr. Myers over, continue our conversation. Dr.
Sure.
Myers, question in the studio is, what motivates you to get up every day to help patients?
My faith in God. I promised God that if I get into medical school, I will do everything I can to help people. The next day, I got my acceptance letter. I never forgot my vow.
So it's a story of not only meeting your wife, who is a nurse, and your family, who are all medical in the medical field. It's about faith.
I shouldn't be here. I shouldn't be so fortunate to have 3 beautiful kids. The privilege of taking care of people. I'm an immigrant. I came from a country fleeing religious persecution. I didn't speak the language. I didn't have a father role model. I had a mother who worked very hard to make sure that we bettered ourselves. And she told me, she made me realize her mantra is helping yourself starts by helping other people.
And how does that feel for you to continue the legacy?
Oh, rewarding. I don't have a job. My job is not a job. It's a joy. I like what I do. I don't dread getting up in the morning. I'm woken up usually at 5 a.m. by my son who says, "Dad, let's go train." We go to the gym, come back, have breakfast, and I've started my day already with my kids. I shower, get ready to go to work. I see a lot of athletes because people come and ask me, what are the exercises we can do? Help guide me through my post-op recovery so I can get back to where I want to be. So I don't just preach it, I don't just express it, I actually live it.
And now that you're teaching students, med students, and residents, do you see a difference in the training that you're able to instill and the wisdom than when you were in medical school?
Yeah, times have changed, and the experiences that people get have changed. I was back at a time where the work restrictions were not really enforced. So I've become accustomed to not sleeping as much, but I do get my 7 hours now. But yeah, there's definitely a difference. Before my wife, when she was a nurse and I was in training, she would laugh because she'd see me in the back of the ER thumbing through a book, voraciously reading on how to do a procedure, and then I would go and implement my skill. Now we have a lot more access with ChatGPT and the internet. So certainly, I think a lot of those things are better. I think that it's better that we can have near immediate access to a question that we have to educate ourselves on something that we may have learned and not been so fresh on.
And that's the medical side. That's the science behind it. But the faith side of it, the belief in God and the spirituality of where you are, do you feel like this is your calling?
I feel a deep connection with my patients of all religions. I grew up surrounded by every type of faith. Um, Certainly tonight we're hosting a religious reading here, where we were asked to provide our house for a large group of females who have a deep religious belief, and we're happy to do so. I also believe that every person is equal in the eyes of our Creator, whichever one you believe that is. As long as I'm here and remember to stay humble and serve my fellow man and female, I have been blessed with guided hands.
And I think it's so important. It has to make your patients feel so comfortable to know that not only are you talented in the operating room, but you believe in a higher power to get them through, them and their families.
I appreciate the compliment. I am persistent to make sure that Every person is special. And in our office, what we like to do is we have 3 nurses on staff. Patients that are scheduled for surgery, they don't have limited access to their doctor, just to office hours. We give them a phone number where they can text if they have an issue, a question, a concern. And the response is maybe not immediate, but it's certainly within the next 10 to 15 minutes because the person who gets those text messages is my nurse. And she wants to make sure that I'm happy. And I'm only happy if my people are happy. Those are my patients.
And why is that relationship with your patient so important? Why is that extra push, that extra you can contact me, so important to your practice?
Because you heal when you know you're supported.
Yeah.
You feel pain when you don't understand the reason. If you can reach your doctor with a question, your road to recovery is that much shorter because these concerns, fears of the unknown are answered. And that's why it's important.
And where do you perform most of your procedures?
So, depending on the procedure and the patient preference, we use a surgery center. I use a cardiovascular surgery center, which has all the most advanced equipment for not only my surgeries, but for cardiovascular outpatient surgery. And the other one I use is a level 1 trauma center. This is a JACO certified government run trauma center. And when you're selecting your surgeon, investigate that person. Know if they're located in the area where they're having the surgery. Some surgeons like to do itinerant surgery where they practice in one state but they live in another. I live here in South Florida. If I have to get someplace, depending on traffic, I'm not more than 45 minutes away.
And what does JACO certified mean? What are they looking for?
It means that they are certified by the highest level in the state.
So all of those are important aspects when you're looking for a surgeon. And that being at a cardiovascular surgery center, you know you've got cardiologists there. Should anything need extra attention, you've got the specialist right there.
Right. I'm not only able to do it outpatient in a surgery center, but I have privileges at the major facilities. If something happens and someone needs to go to a hospital, either immediately in the perioperative period or even later, I've had patients call and they have a cough after surgery. I'm like, I'm 2 minutes away from Broward Health. Go there. Let me come there. I can advocate. I can examine you and see if there's something I need to be concerned over.
And what's the best contact information for people to find you in your practice?
They can contact records at spinesolutionsfl.com. They can also call the number 954-983-3888.
And let me ask, fun fact about you.
I'm a nerd. I like to read. If I'm not doing surgery or hanging out with my kids, you can usually kind of find me in the corner just trying to squirrel away some topic. And it doesn't have to be related to spine surgery. I love crime and investigation. I love learning about dark psychology, tricks. I just love that stuff.
How do you feel medicine has changed for the better throughout your career?
I think that we are making advances in medicine by leaps and bounds in robotics, nanosurgery, medication changes. I think the peptides have opened up a new avenue for at least investigation and research to help patients in areas where they were previously unable to get to the goals they were reaching. A lot of this is private company funded, but it's also very patient driven. So I think that the research and education has been what the majority of the advances have been.
And are there different peptides and things that you can use within your field as well?
There are doctors that specialize just in that. And again, in line with my prior mention, if I'm not the best person for you, for the question or that field, I'll refer you to the one who is. And that's normally what we do.
The field of robotics is fascinating because robotics cannot operate without the skilled physician operating the machine.
Correct.
And that's what I think I want people to realize, that if you're using robotic surgery, you're the one doing it. The robot is not operating on a patient without you there or without the surgeon in place.
Right. In spine surgery, the robot is the extension of the surgeon. The surgeon is the one who looks at the anatomy, programs the robot, and enables the robot to place the instrumentation in the location that they want.
Are you able to use that for disc replacements, infusions?
So there are a variety of different robots that provide a variety of different options. Admittedly, the technology is not to my liking. I was the pioneering surgeon at Aventura who helped bring in their first robot. And certainly it has a place, but they have yet, I'll be the first person to be delighted if a robot replaces me because the results are better. They're just not there yet.
Well, the human touch and everything you've told us about your faith, why you're a physician, what motivates you every day, is why patients come to you. The robot is the extension of your arm and your vision, but certainly it's your techniques that make the robot as successful as it is.
You're not going to hug your robot.
Exactly. Hard to thank your robot. You thank them for the
Yeah.
success of the surgery, right? But at the
They-
end of the day,
they-
you get
they-
to hug your physician and say thank you.
They're not going to appreciate the apple strudel that you made the night before your office visit. I will.
Well, Dr. Ben Myers, thank you so much for joining us. I hope we get to meet you in person. Our studio is located
What?
very close to your Boca office.
What a pleasure and what an honor to be able to talk to your audience. I sincerely thank you for this opportunity. It was delightful.
And one more time, the best phone number to reach your office at.
954 983 3888. I'm the only verified Ben Myers on Facebook. You can also find us at spinesolutionsfl.com.
Wonderful. Have a wonderful evening, Dr. Myers. Thank you so much. Happy holidays to you and your family.
Thank you. Thank you. Bye bye.
Bye-bye. All right. Thank you so much for joining us this evening. For more information, you can contact All County Healthcare at 954-717-7027 or email them at info@allcountyhealthcare.com for all of your home healthcare needs. I am Dawn Graubert. Have a wonderful evening. Happy holidays, and we'll see you next time.